Your body can lose protection long before you feel a single symptom. And after 65, stopping a statin can quietly raise your risk while you still feel completely normal. If you want to stay healthy and independent as you age, hit that subscribe button right now. We share science-backed health tips like this every single day. Over the years, one pattern shows up again and again. A person feels fine, their cholesterol looked better on the last test, and they start wondering, do I still need this pill? Then a few months later, the picture changes, not always with pain, but with numbers, blood flow, and hidden risk. That is the part many people never hear clearly. Here's the thing. This is not about scaring you. It's about helping you understand what may happen inside your body after 65 if you stop taking statins, and what smart next steps can protect you. Now, before we continue, tell me your age and where you're watching from in the comments. This helps us understand who we're helping. Here's what most people get wrong. They think statins are only about cholesterol numbers, so if the number improves, they assume the job is done. But statins do more than that. They help lower harmful LDL cholesterol, yes, but they also help calm stress inside your blood vessels. They are not a paint job. They are more like a maintenance crew working quietly inside your pipes. And this matters more after 65 because your risk is not only about one lab result. Your age, your blood pressure, your diabetes risk, your past smoking, your kidneys, your family history, all of that becomes part of the story. A 2021 study from the University of Southern Denmark found that adults aged 75 and older who stopped long-term statins had a 32% higher rate of major heart and stroke events in primary prevention and a 28% higher rate in secondary prevention. That means the risk went up not only for people with past heart disease, but also for some who were taking statins to prevent a first event. Does that mean everyone should stay on statins forever? No, let me be clear. Some older adults do need a dose change. Some need a different drug. Some, especially people with severe frailty or limited life expectancy, may have good reasons to stop. But stopping is not a tiny choice. It is not like skipping a multivitamin. It needs a plan. Number 5, your cholesterol can rebound. Most people think if I stop the statin, my cholesterol will just stay where it is for a while. But actually, your statin is not teaching your liver a lifelong lesson. It is more like a traffic cop standing in the road. While the cop is there, traffic slows down. When the cop leaves, traffic starts rushing again. That means your LDL, the kind many people call bad cholesterol, can start climbing back because the medicine is no longer blocking as much cholesterol production in your liver. And here's the tricky part. You usually do not feel cholesterol rising. There is no alarm bell, no pain, no buzzing, no red light on your forehead. So you can feel better emotionally and be worse off biologically. Have you ever noticed how the most dangerous changes are often the quiet ones? A 2021 study from the University of Southern Denmark found that in older adults who stopped long-term statins, there was about one extra major cardiovascular event each year for every 112 people who stopped in primary prevention, and one extra event for every 77 people who stopped in secondary prevention. That is not a small change. That is your body losing a layer of protection. So what should you do if you are thinking about stopping? Not guess, but measure. Ask for a fresh lipid panel before any change. Then ask when you should recheck it after the change. Many doctors will want follow-up testing, not silence. Keep your routine steady during that period so the numbers mean something. Now let's talk food, because this is where many people reach for something natural without knowing what actually helps. A 2018 study with University of Toronto researchers found that about 10.2 grams of psyllium a day lowered LDL cholesterol by about 0.33 millimole/L, which is roughly 13 millimoles/DL. That means a simple fiber routine can support your numbers. You can mix 10 grams of psyllium husk into water once a day, or split it into 2 smaller servings if your stomach is sensitive. 1 bowl of oatmeal or oat bran cereal can also help. Search for a serving that gives about 3 to 4 grams of soluble fiber. Add half a cup of beans at lunch or dinner, and you have a strong start. Not a miracle, but a meaningful support. Quick question, have you ever had a cholesterol test come back worse than you expected? Comment yes or no below. Number 4, your artery walls may lose some of their calm. Most people think cholesterol is the whole story, but actually your arteries are living tissue. They react, they get irritated, they heal, they inflame. Think of the inside of your blood vessels like the smooth lining of a non-stick pan. When things are calm, blood moves through more easily. When that lining gets irritated again, it becomes easier for trouble to stick. This is one reason stopping statins can matter even when you do not feel different. In a 2019 nationwide study in France, adults who stopped statins at age 75 had a 33% higher risk of being admitted to the hospital for a heart or blood vessel problem. The risk of a coronary event, things like heart trouble linked to blocked arteries, was 46% higher. The risk of blood vessel problems such as stroke was 26% higher. Read that again in your mind. Not more symptoms first, but more risk first. Why does that happen? Because plaque, the fatty material inside artery walls, is not just sitting there like a brick. It can act more like wet mud on a slope. When the body is less protected, that slope can become less stable, and when plaque becomes unstable, it can crack, clot, and block blood flow. That is when emergencies happen. So what can you do if you and your doctor are changing your statin plan? Focus on calm, not chaos. Keep your blood pressure controlled. Do not change 5 things at once. Avoid the all or nothing mindset. If you are reducing a dose, be even more consistent with walking, sleep, and food. One food choice that may help is walnuts. A 2021 study involving Loma Linda University and researchers in Barcelona found that older adults who ate about half a cup of walnuts every day for 2 years lowered LDL cholesterol by 4.3 mg/dl, reduced total LDL particles by 4.3%, and reduced small LDL particles by 6.1%. Why do small LDL particles matter? Because they are more likely to slip into artery walls like fine dust getting into tiny cracks. So if you want a practical move, try this. Add half a cup of walnuts to your day. You can split it, a quarter cup in the morning, a quarter cup later. Pair that with a plate built around beans, vegetables, and olive oil. Not fancy, but effective. But wait until you see number 3. Number 3, your risk can rise before your body sends a warning. Most people think, if stopping statins were hurting me, I would feel it. But actually, your body does not send early warning pain for high cholesterol, unstable plaque, or narrowing arteries. Your body is not being dramatic, it is being quiet. That is what makes this so dangerous. Look, you can wake up, make coffee, feel normal, and still have more risk building in the background. That is why so many people make decisions based on how they feel instead of what their risk really is. But heart disease does not care how cheerful you felt that morning. It cares about what is happening in your bloodstream and artery walls. This is why follow-up matters so much after 65. Not vague advice, but a calendar. If you stop or lower a statin, ask when your cholesterol will be rechecked. Ask whether your doctor is watching LDL alone or non-HDL cholesterol too. Ask whether your blood pressure, blood sugar, and kidney numbers make your risk higher. Do you see the difference? Not I stopped and hoped, but I changed course and watched carefully. Food can support this step, but it has to be specific. Half a cup of lentils gives you a useful dose of fiber and plant nutrients. Half a cup of chickpeas does the same. A breakfast built around oats plus a dinner with beans can help push your routine in the right direction. And if your doctor says fiber supplements are safe for you, that 10-gram psyllium routine may give added help. Think of it like putting sandbags around a door before a storm. It may not stop everything, but it reduces the damage. Before we go further, if this is making sense so far, hit that like button. It tells me you want more videos like this. Number 2, feeling better does not always mean you made the safer choice. Now this one surprises people. Some older adults stop statins and say, I feel better already. Maybe the muscles ache less, maybe the joints feel looser, maybe they just feel relieved to take one less pill. And that feeling is real. I'm not dismissing it, but feeling better and being safer are not always the same thing. Not comfort alone, but comfort plus protection. That is the goal. Statins can cause side effects in some people. Harvard Health notes that about 10% of people develop muscle aches, and depending on dose, statins may raise diabetes risk by 10% to 35%, especially in people who already have obesity or prediabetes. So yes, side effects matter. They should never be brushed aside, but the answer is not always to stop. Sometimes the answer is to adjust. A 2023 study reported by Stanford Medicine found that among first-time statin users, adults age 75 and older often got a greater LDL drop from lower intensity statins than younger adults. For example, with 20 milligrams of simvastatin, LDL dropped 39.0% in older adults versus 33.8% in younger adults. With 20 milligrams of atorvastatin, it dropped 44.2% versus 40.2%. That means after 65, you may need a smarter dose, not no dose at all. So if you are having trouble, do not disappear from treatment. Go back to the table, ask whether a lower dose makes sense. Ask whether a different statin makes sense. Ask whether taking it at a different time or changing the intensity could reduce side effects while keeping some protection. That is a grown-up strategy. Not quit, but refine. And while you are doing that, support your body with foods that work quietly in the background. About half a cup of walnuts a day can help. A bowl of oat bran or oatmeal can help. Half a cup of beans can help. 10 grams of psyllium can help. None of these are substitutes for a high-risk person who truly needs medicine, but they are strong teammates. I'd love to hear your story. What made you click on this video today? Share in the comments. Number 1, after 65, the real issue is not just the pill. It is your plan. This is the biggest point of all. Most people think the decision is simple, take the statin or stop the statin, but actually the real question is this: what is your risk now, today, with your age, your history, and your goals? A 2024 systematic review in the Journal of the American Geriatric Society found that stopping statins was linked with higher cardiovascular events in both primary and secondary prevention across most studies, and was also linked with higher death risk in many of them. That does not mean every older adult should keep taking one no matter what. It means you need an individualized plan, not a guess. If you had a heart attack, stroke, stent, bypass, or known artery disease, the conversation is very different from someone who took a statin only because of age and cholesterol. If you are frail, losing weight, taking many drugs, or dealing with serious illness, the balance may shift. If you are active, independent, and at high cardiovascular risk, the balance may shift the other way. Do you see why one-size-fits-all advice can fail you? Your body after 65 is like a house you have lived in for decades. You do not fix it by ignoring it, and you do not fix it by tearing random things out. You inspect, you test, you repair. You adjust, you keep what still protects you. Let's pump the brakes for a second. I'm not saying this to scare you, but you should never stop a statin suddenly without talking to your doctor first, especially if you have had heart disease, diabetes, stroke, kidney disease, or very high cholesterol. If you get severe muscle pain, sudden weakness, dark urine, chest pain, trouble speaking, face drooping, or one-sided numbness, get medical help right away. If you are having milder muscle aches, rising blood sugar, or brain fog concerns, that is still worth a medical visit. Sometimes the drug is the issue, sometimes the dose is the issue, sometimes another medicine in the mix is the issue. And remember, guidelines reviewed in older adults say stopping may be reasonable in certain people with major frailty, multiple serious illnesses, or limited life expectancy. So this video is not telling you to ignore side effects or force a treatment that does not fit your life. It is telling you not to make this decision blindly. So you're convinced, but thinking, how do I actually do this? Start simple. First, do not stop on your own. Book the appointment. Second, ask 3 direct questions. What is my real heart risk right now? If I am having side effects, can we lower the dose or switch the statin? And when should I repeat my blood work if we change anything? Third, build one low-cost support routine you can actually keep. Here's an easy daily routine. At breakfast, have oatmeal or oat bran, and if approved, take psyllium with water. At lunch or dinner, add half a cup of beans or lentils. Keep half a cup of walnuts for the day if they fit your budget. Walk 20 to 30 minutes most days, even if you split it into 2 shorter walks. Bring your medicine list to your next visit. Keep it boring, keep it steady, that is how you win. Look, there's a lot of noise out there. Some people say statins are poison, others say everyone should stay on them forever. The truth is usually quieter than that. After 65, stopping a statin can lead to rising cholesterol, less stable artery health, and more hidden risk even before you feel a thing. But it is also true that some people need dose changes, better monitoring, or a different plan. You don't need to overthink this. Start with just one step. Do not make the decision alone. Get your numbers checked. Ask about your real risk. Then support your body with the basics that still matter every single day. Your body will tell you if it's working, not always with feelings, but with steadier numbers, better follow-up, and fewer surprises. If this helped you, hit that like button. And if you want more videos like this, make sure you're subscribed because we post new health tips every single day. Stay healthy, stay strong.